Welcome back to the Aberdeen Audiology YouTube channel. I'm Dr. Tom Goin with Aberdeen Audiology, our Chief Audiology Officer. Um, I wanted to take a few minutes to spend some time, doing some education. That's what we do with this channel. And today I wanted to educate folks a little bit on things that you should do before going to see a physical therapist for vestibular therapy. Now, first of all, what is vestibular therapy? Well, it's when somebody is dizzy, unsteady, at risk of falling. A lot of times an ear, nose, and throat physician or an audiologist or a primary care physician will suggest that this person go see a physical therapist to sort of have their vestibular system and their balance system recalibrated, so to speak, through physical therapy. It When targeted appropriately, it works really well. Physical therapists do a wonderful job with this. And if they give you some homework to do, meaning some exercises at home, it's good to do those. But there are some things that really you should do before going to see a physical therapist for vestibular therapy. And the main thing is have a balance test done first before going to see the physical therapist. The fact is, there are dozens or hundreds of reasons for someone to be dizzy or imbalanced or unsteady or having episodes of vertigo. There can be any number of different reasons for this. Our balance system is made up of our eyes, our ears, and what's called proprioception, meaning the sense of our limbs in space. So if I'm leaning over, I'll feel more pressure in one leg than another. And then it's the brain that integrates all of this information from the eyes, the ears, and our limbs and our sense of space. And so, and then there's reflexes between all these things. There's actually something called the vestibular ocular reflex that goes between the eyes and the ears. And so sometimes it's some of these individual systems working together to help keep us balanced. And so if any of these things are off, if your sensation of your limbs is not what it should be, your ears are not what they should be, your eyes are not what they should be, or your brain doesn't process as well as it should be in terms of balance and steadiness, it can throw things off. It can put you at risk for falling. It impacts quality of life, makes it difficult to navigate the world if you feel a little unsteady. And so having a balance test done first before going to see our friends in physical therapy is a really good idea, because our testing that we do can narrow down, of all those things that could possibly be causing your dizziness, what is it? Is it the eyes? Is it the ears? Is it the brain? Is it proprioception? Which is it? And so if you have that information, then when you go to see the physical therapist can be much more efficient. They don't need to spend time doing sort of some general exercises with you in an effort to almost sort of backdoor the diagnosis and figure out what your issues might be. The moment you get there with a report from an audiologist about your dizziness, they will know exactly what to get to work on. Now, why is that important? Well, you probably have better things to do than to go see, a physical therapist. Don't get me wrong. Again, wonderful people. They do a great job. But, it's all about quality of life and enjoying things. And so, frankly, you probably have some better things that you would like to do with your time than go there. Now, on the other hand, if you enjoy going, that's fine. Go ahead. Go ahead. Wouldn't want to stop you. But, and for some folks, their insurance limits the number of visits they can have with a physical therapist, unfortunately. So what you don't want to do is sort of use up any of those precious sessions in the beginning trying to sort out what your problem actually is, and sort of wasting those sessions for actual targeted, efficient therapy. So, again, to be clear, I'm not suggesting you skip physical therapy for vestibular issues at all. As a matter of fact, I highly encourage it. But the right way to do it would be to have the balance testing first, find out if your ears are the issue, your eyes are the issue, the way your ears and eyes work together are the issue. If your brain isn't processing things right, if it's more your limbs. Um, and, in most cases, physical therapy is the right thing to do. But sometimes we also find that actually a physical therapist is not what you need. Sometimes we find that a neurologist is the right person to be seeing. Sometimes we find your primary care doctor is the right person to be seeing. Sometimes we find a cardiologist is the right person to be seeing. Sometimes we find you need all of those things. So, having the balance testing done first just makes a whole lot more sense. It's if the old phrase "don't get the cart before the horse." It's not as if your time would be totally wasted skipping the balance appointment and going straight to physical therapy, but your time will be better spent. It will be more efficient. It will save you time and potentially money by having a balance test done before you go see physical therapy. So again, I'm not suggesting you don't go see the physical therapist. I'm just suggesting you see an audiologist first. So if this sounds like something that could benefit you, you're in the Philadelphia area, give us a call. We are Aberdeen Audiology, offices in Wayne, Malvern, and Westchester. You can look us up on the web. Our phone number will follow after the video, and hopefully we can help. Hopefully you found this video helpful. Let us know your thoughts.